So it turned out that um, everybody that I've talked to so far, and I have a lifetime of people that I get to talk to, um, mine is a little worse than what these people have been dealing with. My vestibular support group, mine, everybody else gets to be on the camera looking at each other. And if you notice, I look away most
Yeah,
of the time that I'm talking to you, because it's triggering in my head. But it's something I'm used to and I've learned how to accommodate. So everybody else gets to look at the screen and I can't, because we're all different. Just like all of our strokes are different, vestibular disorders are different, and I have to acknowledge that when I'm going to these doctors and they're like, "I don't know what's wrong with you." I
yeah,
have to understand that our bodies and our brains, they just haven't figured it out yet.
yep,
And who knows when they're gonna. So complex we are.
yes, exactly, and especially the brain part. Would it
Yeah.
help if I took off my video for you?
No, no, I
Oh,
wanna
okay,
I enjoy getting that, at
good.
least some visual feedback, yeah, so
Well, I guess you mentioned that, our strokes are different, our recoveries are different, but there's some things that are similar to um, becoming a little more authentic or um, uh, vulnerable to listening
yeah,
to other support survivors, the stroke support groups. I mean, the mental health part that they didn't tell us about or warn
yeah,
us about has become so important. You've got an interesting background that got you through a lot of that mental health.
that's right.
Do you mind sharing that?
No, no, I want to share about it because it is so important to my recovery. So, I'm a recovering alcoholic and I have been sober for about 8.5 years. So,
God bless.
thank you, April of 2016 is my sobriety date, April 28th. And it's really been fascinating that my journey in stroke recovery has mimicked my sobriety journey in that in both situations